Welcome to Designing Healthcare That Cares, the show where we explore how to build healthcare systems where people and performance thrive. I'm your host, Dr. Laura Suttin, a physician, coach, and healthcare leader who believes that human flourishing and organizational excellence go hand in hand. Each week, I talk with leaders, change makers, and innovators about how to shift culture, lead with purpose, and tackle the root causes of burnout. Because when healthcare works for the people in it, everyone wins. Welcome to the Designing Healthcare That Cares podcast. I'm so excited to talk to my guest today, Dr. Sarah Smith. Sarah, welcome to the show. I'll read your bio and then we'll jump in. So Dr. Sarah Smith is a rural family doctor, general practitioner, and rural emergency department physician. She's also recognized as a clinical day advisor and charting coach, supporting doctors, residents, registrars, and clinicians. In her work as a clinical day advisor and charting coach, Dr. Smith helps medical professionals restructure their clinical day so that essential tasks can be completed within work hours. Yes. This approach reduces after-hours charting, eases the burden of administrative demands, and creates more time for life outside of medicine. With a strong commitment to addressing healthcare and administrative burnout, Dr. Smith provides practical strategies that allow clinicians to build sustainable practices while maintaining balance and well-being in their personal and professional lives. Dr. Smith, welcome.
Thank you so much for having me.
Okay, so before we hit record, we were talking about all the things we wanted to dive into and definitely want to get into that. But I'm curious, how did you become the charting coach?
That's a great question. So as a busy general practitioner in Australia, initially early in my career, I had no idea how to do the work of the day within work hours. And this was before we could remote in from home. So that would be hours of work after the last patient left and coming in on the weekend to do lots more hours of work. And that was completing the patient charts, inboxes, referral letters, those types of things that were just spilling over into my non-clinical time. And I had two small children. So I had a stay-at-home husband and the two small kids. And I just hated the working after hours and on weekends. And I thought that I would just get better at this. And I asked mentors how to do it. And the answer was come in on Sunday back then. We traveled around Australia for a year and a half, which was wonderful. And then we went across to Canada, where I was a rural family doctor and hospitalist and emergency department doctor. And the problem was that all of this charting after hours, labs, not getting home on time for supper, then having to go back and do work on the computer after hours, I was just missing out on family time. And this was my kid who was in grade 10 at this point. Like I had been a family doctor for a while and it still wasn't getting any better. And I had no idea how to fix this, but I knew I was missing out on my life and I did not like that anymore. So I used a general life coach at that point. So we're talking 2017 kind of era to try and help me do an impossible task, which was I want to see the patients and be done after the last patient and go home with no homework. Now that was impossible when I was spending more than 10, 15 plus hours a week outside clinical day doing the work of the day. It required an everything transformation. It took me 18 months and I did it. And then I had a bucket load of time. I was still doing what I was doing. I was still seeing the same number of patients. I was still working in the same clinic with the same EMR. And then I'm like, wow, this is incredible. And now I need to go help my colleagues. So that's how I ended up with this totally different experience of clinical medicine.
And you know what works, and just so beautiful how you took that to, okay, I've got this figured out. I've got some answers here. Now I need to go tell people, like you said, teach your colleagues. And just in my world, in the physician world, like we hear charting coach, we think of you. And so you're one of a kind in that way, because it's so important. And we were talking before we hit record about just, if you think about designing healthcare that cares, where does the care for the clinician come in and all the demands on the clinician? And yeah, well, I don't want to repeat what you said, so I'll let you take it.
Yeah. So if we're looking at designing healthcare that cares, we're looking at what is it about your day that is not structured in a way that ever really considered you in the equation. Okay. So everybody asks us to do more. We've never, ever had the experience where somebody came down the corridor and said, can you see less patients today? Or can I take half your inbox for you today? Like nobody ever says that, ever. And so really it was a matter of understanding nobody respects my time. That's going to have to be my job.
Yeah.
That was one of the earliest things I had to learn in a way to care for me too. I will give to my patients. If left to my own devices, they will take all of me and I'll have zero left for anybody, me or my family by end of day. You know that. And that is the experience of most doctors and clinicians. So now we say, okay, now what? As you start to look at the things coming in your inbox, they're creating interruption. And there's a lot of things in there that are not physician work.
Yeah.
Mr. Jones is looking for an earlier appointment. Well, he's got the earliest one available if he's got one. So why are you getting that message? And who do you need to go and give permission to get rid of that from your inbox forever? Okay. Let Mr. Jones know he has the earliest available appointment. And if there's a possibility of a wait list, go ahead and put him on it. No problem at all.
Yeah.
Okay. I don't ever want to see that inbox again.
Even as you said that, I don't know if you could tell, I started to get anxious because I'm thinking, oh my gosh, then I have to be the one to go and look for this earlier appointment. And
there isn't any. Otherwise, he would have it.
Exactly. Exactly. Yeah. I mean, I coach a ton of clinicians that just feel overwhelmed, like you said, and feel like they've lost the control of their day, of their time.
Mm-hmm.
I feel like, at least as I'm getting older, I remember the days of paper charts. Younger physicians don't. And so I think middle-aged and older folks like me, we sometimes lament like it was easier. And I don't know if it was easier, but we did, like you said, we didn't take it home.
But here's the thing. We did sometimes take it home or we didn't, but we stayed late. Like if we say, oh, it was better in the olden days, it wasn't.
It wasn't.
The number of charts piling up on my colleague's desk because they hadn't done their chart notes yet. And the poor staff at the front had to go find the chart and it was somewhere buried in somebody's office because the last note wasn't done and they're coming in today for another visit. Like it was not easier.
It was not easier.
Now there is more and more because you are more available. So the staff can message you, the patients can often message you directly. And there should not be a system where the patient can email you direct without somebody in the middle, somebody saying that's not a doctor job. I'll handle that one. Like, honestly, it's not been designed for you.
Right.
And when you realize that, you're like, oh, now how can I start to create team that helps look after each other? How can we all be doing the work at our highest level? And that means I'm not doing this or that. That's somebody else's job. They can get rid of all of those type of things for me.
Yeah.
That's our responsibility. So think about this patient message. They're saying, my little Johnny has a rash. Well, you can write an essay on what sort of rash and how to treat the rash, but you have no idea what the rash is. So we say, how can we do this in less words? What do we actually need? I need to look at little Johnny and his rash. And if it's not me, then who else could? Because answering this in a portal message, I'm not getting paid for it. I'm not getting acknowledged for the work. It's not safe often to do it in that way. Now what? What else is available to us that would get us this out of our inbox as fast as possible, but also create improved patient quality of care?
I love that. Get it out of our inbox as quickly as possible. And then also so much to dive into, just how do we rely on our staff more and do work that's at the top of our license? That was something in my previous role. We used to talk about that a lot, practicing the top of our license. This is probably a loaded question, but where do you start with a physician who comes to you and they're just overwhelmed and spending massive amount of hours per week working their charts? Where do you start?
Start with the littlest thing you can. Start with the noticing. I noticed that I'm here for 3 hours after the last patient leaves. Wonder why. I noticed that I'm running half an hour behind in clinic. I wonder why. I noticed that only 30% of my chart, 10% of my charts, one chart this morning got done. I wonder why. Yeah. And then just that wondering why without the, you should know better than this, or why can't, why haven't you handled this yet? Why aren't you getting, what's wrong with you? all of those types of judgments on you aren't helping, just so you know. You're just creating more angst and stress on yourself. It's just the noticing. I noticed that I got one of my charts done today. Interesting. I wonder why. Oh, because it was a simple thing. Okay, don't do that to yourself. Just be like, I got one chart done today. Good for me. Okay. So it's that starting somewhere and then saying, what do I notice about my charting? Is it blank when I come to it? Is there something in it? How long does it take me and why? What do I like to put in there and why? And you're the expert of your note. So you know that we need the what happened and the things for medico legal and insurance and billing purposes. They all need to be in there. And then some of us love to then dive into this amazing manuscript of information. So it's the noticing of how do I work and what else could I be doing? If I never wanted to do this again in the evening, now what?
Yeah.
What could I be doing differently that would help me closer to the goal of, I want to be home, thank you. Don't want to be doing this on Saturday, thank you.
Yeah. I love that, just noticing and being curious, because I see that a lot from my clients is this beating themselves up, and they're seeing their colleagues getting it done. They might be getting notices from their supervisor about their unlocked notes and patient callbacks because their scripts didn't go through, whatever. We as physicians, we tend to be really hard on ourselves. And so I love
Yeah.
that, just reframing it.
Yeah. The next thing is that you were taught in a way that you learned the ideal patient care. And then you were put into a model where you get 15 minutes or 30 minutes or whatever it looks like where you live or work. And that is not ideal care. And that is not enough time to do things in a way that you were trained to do. And you know you could do and you'd love to do. This is an area of potential harm for us as physicians, as clinicians, that I need to take all of your complexity and squash you into the available time, or throw the time out the window, but then have a negative consequence on the rest of appointments for the day and my evening. And every decision we make has a consequence. So when we say yes to the 15th thing in the room, everything we say yes to has a time consequence. So if you're going to say yes to an exceedingly large list, then you have an exceedingly large amount of noting, documentation, orders. Very easy to say, yes, I'll refer you for your hip replacement. That takes maybe 30 seconds in the room, but you still have to write that letter.
Yeah.
So if it's part of the quality of care for the patient today, pause and do that thing now. So when we're saying we're getting our charting done, we're getting the entire encounter done. So it's now a matter of, this is a skill, and this is a skill that takes time because the consultation is a big thing. There's so many moving parts that every minute and second matters. And you have a lot of autonomy in here. You are the expert in the room, and you are the one who gets to be curious about what is a priority for today. How long is that thing going to take me? What do we need to do about that? What is the information I need to do that safely? Can I also add this other ask in the room? And if not, how do I start to learn to defer that request if safe to do so? If I'm saying yes to it, now what? Am I trapped here trying to get these 3 things done for this patient? No. Even learning the skill of, wait right there, this is important, I need to look after that. But first I need to go tend to that little person next door who needs their immunizations, and then I can come back to you, stay right there.
Yeah.
Even learning to do that made a huge impact in how I felt. Feeling trapped by this patient in the room felt terrible. I was getting more and more frustrated. My stress levels were rising. I knew I did or didn't want to do what they were asking me to do, but I felt like I couldn't go out and advocate for the others in the room.
Yeah. Yeah. I hear that a lot, that trapped feeling. And I love what you said about the autonomy. And, that was something that I learned early on. I think probably from our mutual colleague, Sunny Smith, is every decision we make, we're always a choice, is essentially what it was. And every decision we make has a consequence. Even if it's like, paying taxes is not a choice. Well, it kind of is. I'll go to jail if I don't pay taxes. But that's a consequence, but I don't really have to do anything. I just have to know what the consequences are. Yeah, I think framing it, I know that's an extreme example, but framing it in that way really puts us back in control and gives us that agency when a lot of times we feel like we've lost it. And you talked a little bit about that dynamic between the model of seeing patients every 15 minutes, which a lot of clinicians are, and then this feeling of like, well, I don't know. I feel like I'm having trouble delivering good care in that way. And I imagine that a ton of what you do is not really about the charting, but it's all about the charting, working on mindset and overcoming perfection and that type of thing. So, how do you navigate that with your clients?
Okay, so in that, we have 15 minutes or 30 minutes, whatever it is that is your current lived experience. For whatever reason, you've chosen this because you've not yet walked away from it. So it's a matter of knowing this is not how I would have decided to set up healthcare, right? But right now, this is my lived experience. I have concrete borders on the sides of each of my consultations. Now what? So now we start to be curious because every minute and second matters. And we know that we are creating some harm for you in trying to squish you into 15 minutes with your patients because you're not going to be delivering medicine in the way that you were trained to and the way that you would prefer. So know that this is harmful. Okay. So I'm not saying, oh, this is delightful and we should all want to do 15-minute medicine. No, this is our current lived experience. Notice how it is affecting you. And then how do we do it now? How do we give our best within the confines that we're working within? So no, we're not going to be giving them half a day. But if it's 15 minutes, how can I make it matter? How can I deliver the best I can in the time I have? Now, the time I have is not then and the 3 hours to chart it later. Okay, so don't falsely move the time. Just remember, I've got 15 minutes for the patient and the note. Now what? How do I navigate this? And so there are skills you can learn and there are tools you can use to try and help you navigate that in the best you can with the given circumstances. So you're not going to be bringing your A game to a 15-minute consultation. You're going to be doing your best to advocate for the patient within this time allotted. So it's a matter of how do we start? What are the words we use to get us straight to the point? Not how are you today? Okay. We're talking about what are we doing for you today?
Yeah.
It's going to shave off minutes.
Yeah.
Then when you bring up a blank lab form and you start ticking things off, that is costing you seconds. How can you start to set things up for you that'll take less time?
Yeah.
How do we navigate the request in the room? I have this and I have this and I have this. Okay, thank you for telling me. What I'd like to concentrate is this one sounds the most urgent. Is that okay? Well, let's move into that one. I'm going to need you to go and rebook for that or see a resident for that, or we have urgent care available in case that becomes worse between now and our next visit. So starting to learn some of those deflect and defer. It's not a one problem per visit solution. You are the boss of your consultation. Do in it as you please.
Yeah.
But it's a matter of how do we navigate this so that we can do our very best for this patient today with the time allowed.
Yeah. Yeah. I love that. That's so cool. Thinking about the clinicians practicing the top of their license and bringing in the team approach, how do you help the clinicians bring in other team members? I mean, there's such a big part of that. I was fortunate enough to work with registered nurses. I was in an environment where I had a lot of support in that way. But yeah, how do you really approach that with somebody who's struggling from a team staffing perspective?
Yeah. So our team members are also busy. Their entire day is used up.
Right.
Rare you've got somebody sitting twiddling their thumbs while everybody else is
Right.
lathered and the bit with the amount of work they have. So we can't just walk up to them and say, hey, I'd love you to look at my inbox ahead of me and get rid of all the messages that aren't for me. They're not going to go down well, just like them coming and asking you to do some of their work, right? So it's the talking with them and saying, what is your day filled with that we could take off your plate, give to someone else, stop doing altogether, that would allow opportunity for doing some of this type of work. So it is in relationship and negotiation with the goal in mind. Our patients are here to get quality of care. And that's not just from me. That's from everybody, from the front reception person who checks them in and says, and by the way, your chart's telling me your mammogram is due. Can I set that up for you? Okay, so there is ways for all of the team to be included in looking after and giving quality patient care. but it's a matter of pausing and saying, all right, tell me, what is it that you're doing in your day? Now, that may not be a conversation. That could be writing it down. What are the things that they're doing in their day? And then having a look at the flow of their day and saying, all right, I noticed that so what an example was, we were getting the nurse to book the ultrasounds. So she would have the patient there and she was back and forward with ultrasound place and the patient trying to get this. They have secretaries for that at the ultrasound place. There is no reason my nurse has to be 10 minutes trying to figure out their calendar and your calendar.
Yeah.
We took that completely off them, sent it through to the ultrasound place and said, please ring the patient.
Yeah.
Why are we using our staff for that? That was such, our bottleneck was waiting for the nurse to do all the vitals before we could see them in the rooms. And yet she was busy doing this. Well, once we discovered that, we took that off her plate. Well, that was
Yeah.
an hour and a bit of her day gone,
Yeah.
reclaimed for other important clinical work she much prefer.
It takes somebody kind of looking at the big picture, and because things get just piled on, and I've seen that so many times. Yeah. It's so interesting just
To chat to people about, how does your day go? Tell me about your day. Tell me what you're doing. And as you listen to them, you're like, do you realize you just said that you were doing that? And the kind of awareness that happens, and they're like, oh yeah,
Mhm.
I'm doing that.
Yeah. Yeah.
And it's that noticing piece. It just comes back to start to be aware of how the day is going for you. What are you doing in your day? Who's coming and knocking on your door? I'll have some physicians who get a knock on the door every appointment. Knock, knock. When you open the door, what is it that you're being asked? Mr. Jones is late. Will you still see him? You don't ever want that, ever.
Yeah.
What's the pop-up saying? And how do we start to get those off your list? Because you've only got so much executive function for the day. And when you're
Right.
using it to try and answer those questions in between that really important high-level work in the room, you want it to really matter, those questions.
Or even the high level work of sitting down maybe over lunch or whatever that non-patient facing time is to get your charts done. And are they interrupting you, or are you getting messages during that time? Like you said, well, what are they asking? Is there a way that can be adjusted? Is there a way that you can just say, hey, I just need 10 minutes
Mhm.
or whatever that looks like?
Batch all those questions and come find me at 1:45 and we'll go
Yeah.
through all, right?
Yes.
How can we do this in a way that's clearer, easier, and done? I was working in a newer medical center and the staff put a Post-it note on my desk with a patient inquiry. And Post-it notes for me disappeared well early in decades ago because they get lost.
Yeah.
They fall off the desk. They walk off on the bottom of your shoe. There's no electronic tracing of them. And that is a patient safety issue from my
Mhm.
perspective. Not happy
Absolutely.
at all. Post-it notes. And so I'm like, but Post-it notes about patients are banned. Put it in an electronic message that is then auditable, trackable. I can give you a feedback loop that it happened. We don't do this anymore. This is not
Yeah.
appropriate.
Yeah.
How do we look after us? How do we look after the patients? We need ways to use the systems that we have in a better way so that things aren't going to get lost like that.
Yeah. And I was just going to segue to this too, is that it's not just about the clinician, it's about the patients, and it's about the staff, and it's about everybody on that team. Because we hear from patients too, they're frustrated that docs are just looking at the computer screen the whole time. And so it's not good for anybody for these haphazard processes to take place. And I had a client, this is a couple months ago, but she, like you, was getting patients would email her, and she was in an academic environment. And so I guess they found her email and they would email her. And she was like, I got to get him to stop emailing me. And so we worked on it. And she came to was telling the patient, I really need you to use the portal. If you email me, I'm not going to see it, and it's not going to be attached to your chart. And it's a safety issue for you if you email me. And so I really need you to use the portal. If you email me, I'm just not going to, I'm not going to be able to respond. And once she framed it like that, then they were like, okay, of course. They just thought they were easily accessing her. And
Yes.
so I think clinicians, we tend to be selfless, right? And we want everybody around us taken care of. And when we can see that this is not just a problem for us, it's a problem for the patients, and it's a problem for the staff. They don't want to be frazzled either. They want to know clearly what's expected of them. And so, how can we all work together as a team to get this? I mean, if the patients are running behind, staff's working overtime. Sometimes they might be happy about that, but usually that's not what people want. And so, how can we have these shared goals of high quality care for the patients and that we're all on the same page? So, yeah. Well, I have to ask you about AI because that's probably changing not so much your coaching approach, but just the technical aspects of it. How do you bring that in?
Yeah. So we say any tool that's saving you time. And so AI might be a tool that saves you time and it might not be. So just so that you know, if you're listening and you're like, I'm still not winning, I've got AI and I don't know what's going wrong. It's only doing one component of the encounter, right? And it may not be doing that very well. So I give it about 2 out of 5 stars right now with its usefulness because you still have to negotiate with the patient what we're doing today in the room. And then we have to put in the orders. We have to do the letters if we're doing referral letters. We have to do the prescriptions. We have to get the forms done that they want done, whatever it is that they ask in the room. And then there's a documentation of the encounter. So maybe the AI's had a listen in and it's doing some of that documentation in the background. Okay, patient encounter ends, patient leaves. And now you've got a choice. You can now look at what the AI has spat out at you, check it for usefulness, and then put it into the file. If sometimes there's a delay. So you hit finish and it's a 2-minute wait for it to have a think and put it together. And then you go check it for accuracy and put it in your chart and then done. Billing and done. So for some physicians, it's another place, another work list that gets put aside to do at some point. And there could be many hundreds of things sitting in there now need to be imported into the file. Is that saving them time? No, that's just creating a new work list. And so for some, it's going to be amazing. It will be that piece that allows them to do a little bit more eye contact in the room. It's doing a decent enough job capturing most of the consultation, but there's still a bit of editing to do. So it's usually a couple of minutes of having a quick read through it, making sure it looks good for accuracy, addressing anything that was inaccurate, but you still have to do things like your after visit summary, your education, and the other pieces of the consultation. So if you're going to use AI, make sure you edit it within the AI program, because that way you're teaching the processors what to do to help you next time. If you export it and then edit it, well, then you're not teaching it anything. So that's one of the handy tips, is that you need to teach it within the processor that's watching and learning. Do it now, because if you leave it till later, you're just giving yourself yet another work list to go and do later, which isn't the fun part.
Yeah. The practice where I'm at doesn't use any AI tools. It doesn't really need to. So I hear bits and pieces about it, and it hasn't seemed like the panacea in the clinical space that I think we all had hoped it would. I imagine it will get better.
But you just need to be aware of the potential hiccups that can happen and look at the way you work. Just know that if you're someone who's just going to let that be sitting in the background, then there can be issues with that.
Yeah.
Right? It's another way to trip yourself up.
Yeah.
Some of the programs will literally dump everything out after 30 days. So if you haven't pulled it in, you got nothing. So really have a look at, how does this work for me? Not how do I use this against me?
Absolutely. Use it as another tool. It's so cool to talk to you. Is there anything else that you'd like to share with the audience?
Well, I think that the way we work because we're human, right? So we like pleasure, we hate pain, and we do things efficiently. So doing our charting is painful, right? We don't like that part. We much prefer talking to the patient. Pleasure is if I'm sitting in front of my inbox and I've given myself some time to do my inbox. Of course, I'd rather do cookies, talk to somebody, watch Facebook, right? So just know that your brain is wanting to sabotage you doing this really important but boring work. And then we do things efficiently. So one example was one of the physicians was looking after another physician's my chart messages. And the usual physician would write nice big essays about Johnny's little rash to the mum to help her navigate what could be going on and fix it so that there wouldn't be a banter or a need for a consultation. None of this was paid. So the physician looking after the inbox thought she had to do the same. And suddenly her inbox time went from her usual amount to 4 times the amount, because she's doing things much, much, much differently than how she normally did it. I said, why are you doing it that way? Why did you sign up to do it in her way? Why didn't you just do it your way? She's like, oh yeah, I have choice.
Yeah.
So when we're looking at, okay, I've got 50 messages coming in or 50 results coming in, start noticing how long does it take me? What do I open and say, oh, I don't know what to do with that and close it again? And now you're kicking it around for weeks and you've looked at that message dozens of times. Eventually, everything gets out of your inbox. Sometimes we can't get it out of our inbox because we need some information from the patient. I've got 3 different ways I can solve for this problem, but what I need to know is which is the most appropriate for the patient. I actually need a patient here to know that. So I might just get them back and then you get it out of your inbox. So just kind of notice, oh yeah, that's how I resolve this issue. Now I need to do that thing earlier.
Yeah.
So while we get massive amounts of things in our inbox, we need to be curious, how do we make everything easier, shorter, take less time, less words, less clicks? What would make this easier?
Yeah.
Rather than sending your blood count was normal, your liver function was normal, about 15 different labs, I'm just going to give you one message. Your blood work is stable, your blah, blah, blah. I want this repeated in 3 months. Boom. And the rest of them are just ticked off. Like there's not going to be 15 messages back to the patient. There's one, very quick, less words, less clicks.
Yeah.
If I need a conversation, I'm getting them back. I thought about how will I get them back? Because that's a huge one if there's no access.
Yeah.
That creates further upstream, downstream problems.
Yeah.
So it's really the curating of this so that it can look after you too.
Yeah.
And attainable to the hours that we work.
Yeah.
So everything you do in your day, just notice the noticing. If you come out from a patient room and you open up your inbox and then you just say, I don't have time for that. I don't have time for that. And now you haven't done the chart note too.
Yeah.
And it's just doing work twice.
Yeah.
Keep the noticing of, oh, I noticed that. And these are little ways we keep tripping ourselves up all day.
Yeah.
Yeah.
So important. I love what you just said about have it take care of you too. That's so cool. That's a great way to think about it. Make the workflow and the charting take care of us.
Yeah.
Yeah.
Yeah. After that executive function, make sure you eat, drink, rest.
Oh, yeah. Because if we are taken care of, then we can take better care of our patients and our teams and our families. And that's why you and I get up every day and do what we do. So cool. It's so good to talk to you. So we have your website and your LinkedIn and your Instagram. I know you've got some really great resources on your website. And so anything else that you want to share or highlight?
I think that as you listen, it's going to feel impossible from where you are right now to where you want to be in terms of your clinical day. Because like you already know, the day is overwhelming and it's already packed full. But just know that you can create a different experience of clinical medicine right now if you want it. And it can start with the teeniest, tiniest steps and just slowly moving towards a goal that you would have for you about your clinical day.
That's awesome. Thank you so much. So good to talk to you.
Have a great day.
Thanks for listening to Designing Healthcare That Cares. If today's conversation gave you a new idea or inspired you to see things differently, share this episode with a colleague and keep the conversation going. And if you're ready to take the next step in building a thriving healthcare culture, you can find resources and ways to connect with me at drlaurasuttin.com. This podcast is for educational and informational purposes only. It is not medical advice, and it should not replace care from a qualified healthcare provider. Always seek the guidance of your physician or other qualified professional for any medical questions or decisions.